We are
Whoever's
good.
pressing the button.
We are good to go.
Okay. Good afternoon, everyone. Welcome to the Business Roundtable discussion of the Baltimore County Economic Recovery Subcabinet. My name is Leonard Howie, and I have the privilege of serving as the director of the county's Department of Economic and Workforce Development, as well as the chair of this recovery subcabinet. First of all, on behalf of the county executive and the entire Economic Recovery Subcabinet, many of the members who are actually on today's call, I want to thank each of you for taking the time to be with us today. The plan is to use the time we have to hear directly from you, your observations, and recommendations of what your county government needs to know about the issues faced by the workforce as we recover from the COVID-19 pandemic. And as a special thank you to our senior policy manager, Jasmine Clemens, for really executing what we like to call the intellectual work that's behind our entire process. Now, today is the last of 3 economic recovery roundtables. The first discussion focused on the needs of our business community. The second, which was conducted just yesterday, focused on individuals and families and the issues that they were facing in recovery. And as I said earlier, this final discussion focuses on our county's workforce, which we do recognize has natural connections with employers as well as the needs that we all share as human beings living and working in Baltimore County during this pandemic. Today's roundtable is being live streamed on Baltimore County government's YouTube and Facebook pages. It is also being broadcast on BCG TV. Residents who are watching can submit their economic recovery comments and suggestions to recovery@baltimorecountymd.gov. Now, we are joined today for the first part of our session by our County Administrative Officer, Stacey Rogers. Stacey has been a longtime supporter of everything that is good in life, and we are so happy that she is here with us to really kick us off with our work today, and also just to maybe tell a little bit about some of the recovery-related initiatives that she has been heading for the county government. So, Stacey?
Thank you so much, Director Howie and colleagues. Thank you for taking time to join us today for the third discussion in our recovery listening sections. The first 2 have been so informative as we talk with members of the business community. Then we talk with colleagues from the nonprofit and support areas and advocacy community. And today, really excited to hear your thoughts from the workforce perspective, which we know spans the continuum. It's also a great day for me to be with you because, as I said a little earlier, this marks my 2-year anniversary in coming to the county to serve in the role as the administrative officer. Now, most people ask, what does the county administrative officer do? My job is to ensure the efficient and effective operation of government services, all of the agencies. So work with outstanding colleagues here in the county, the directors of our agencies. We work together in an integrated approach to deliver comprehensive services to the citizenry across the board, whether it's fire, whether it's health, even animal services. We've had some interesting, unique experiences there, but we're here to serve the public. That is indeed the reason why government exists, to serve the public in coordination and collaboration with our colleagues from the public advocacy, just the citizens getting input. And that's what these roundtables have been set up to do, to continue that open dialogue and connectivity. I'm just really pleased with the number of efforts. The thing about the response to the pandemic is there was no playbook. No one, no matter how many years of service in government you've had, had experience with addressing a global pandemic. But I want to say here in Baltimore County, we absolutely have taken the best of the best, whether it's connectivity in terms of IT, innovations, using innovative IT solutions to get monies out to organizations, delivering food to families in need. And now one of our biggest endeavors, of course, is working on the distribution of COVID vaccine to our citizenry, which has again been a unique situation. We have experience in delivering flu vaccines each winter, but to try to vaccinate thousands and thousands of our residents in a short period of time, I must say, hats off to Dr. Gregory Branch and the Department of Health and colleagues, and across the enterprise for everyone who has helped to staff our vaccination site at Timonium Fairgrounds, which has been touted as one of the best run in the state, if not in the nation. So we have really had a lot on our plates, but now it's time to look forward at what recovery looks like. And some of the questions that have been posed today will help us look at that from the lens of workforce needs. And when we think about workforce, I always, emphasize workforce is from early experiences through summer youth programs through senior workforce needs. And Joe knows that I will always have a place in my heart for youth and seniors, given my work over the years. But that's what our discussion today is. What does that look like in terms of support for the workforce, whether it's a summer youth worker in their first job, or whether it's a senior who is seeking to supplement their income and now needing to do that in a COVID environment. And then our just general workforce that we deal with each and every day, people in transition in jobs, women who have transitioned out of jobs because of the pandemic, and competing responsibilities with whether it was caring for a older adult at home or having to homeschool in terms of their virtual learning environment. So I think we have a lot to talk about. And Director Howie, I will end there by saying, so glad to be here. I'll be here for most of the discussion, but I do have a meeting with the CE actually at 1:30.
Okay. Well, thank you very much, Madam CAO. Now, one thing that I'll add to our Chief Administrative Officer's introduction there is that she has overall responsibility over the preparation of our budget. And these discussions are vital to that process. The county executive gave us a tasking to think big, to see what we can do to help the county recover from this pandemic. And if there can be a silver lining in this tough time that we've been in, is that we are in the process of receiving unprecedented resources from the state and federal levels. So we need the big ideas. We need the nuts and bolts ideas that we have to operationalize and to put into a format that we can move forward and fund, and to help us move into the recovery phase and get out of where we are. But as the CE says, it's not just to recover, it's to build back better than we were when we went into the pandemic. So with that said, we'll go ahead and get started with the questions. There are three basic questions that we're going to go over. I'm just going to call you in the order that I have you on my list here. And we'll have a good exchange here. Okay, the first question is, I'm sorry. And as you prepare to answer your question, go ahead and just briefly introduce yourself, your organization that you're representing, and any other opening comments that you'd like to make. Question number one. As each day goes by, we get closer to fully reopening the Maryland economy. But just because reopening is on the horizon, we know that many challenges will remain. What are the most important actions that an employer can take to make employees or even customers feel safe from a health perspective in the workplace? Again, please address this question you can address it from the perspective of management, or you can address it from the perspective of being an employee. So what are the most important actions that employers can take to really get people back to work is what this is asking. So Marcus, we'll start with you.
Thank you, Leonard. My name is Marcus Wang. I'm from Zytogen Global Genetics Institute, and I'm very happy to be here today. I think the most important thing we can focus on is messaging. I think the county's been doing a very great job, an excellent job in taking care of the issues raised by COVID, but we're not operating in a vacuum. And we have to combat this fog of disinformation and misinformation that's floating out there in the mass media, on social media, Facebook, Twitter, Reddit, you have it. I'm hearing from different people, from different generations, different walks of life, different education levels and backgrounds. And there is considerable confusion right now about what is safe and what is not. You know, some people think they've gotten the vaccine and it's a miracle shot. They can do whatever they want. There are holdouts who don't want the vaccine. There are people who want it and they're afraid they've been unable to gain access. No one knows what the rules are, and now it's going according to people's personal preferences and their personal risk tolerance as to what they do. And so the question for us from a human level, as well as a probably liability level, is how do we communicate to people what is safe to do, what is not safe to do, to cut through the fog of disinformation and make people feel comfortable in getting back out and about, supporting our businesses and going to work.
Okay. Wow, cutting through the fog of disinformation. That's powerful. Okay, I'm sure we will come back to that theme. Thank you, Marcus.
Thank you.
Deetra.
Hi, good afternoon, everybody. Thank you for having me participate today. So I work for M&T Bank. I'm a business banking regional manager, and I head our segment that focuses on minority and women-owned businesses. And I would say for us, in addition to what Marcus said, just around communication and handling the management of what information gets out there, really in having a support system for employees. Because there is so much confusion, and some people may be a little bit more risk adverse than others when it comes to how they're engaging with individuals. But how are employers going to be able to protect the employees when they do go back to work? So for us, we're in a bit of a phased, come back to work. Many of us are working virtual. Of course, we are in an industry that are critical employees. So our branch network, all of our branch networks have been open since the pandemic. But in terms of our back office and more of the roles like myself, where we don't actually work inside of a branch, what does that look like for our employee base? So we have some offices that are coming back, but there are some of our employees that are concerned about being able to come back into the office and being able to do that safely, right? So some people have offices, some people work out of cubes. And if people are working in cubes, they have to wear their mask the entire time. How many people can be in one space at a time? So just trying to make sure that there are resources that employees know about, make sure the communication is very fluid, and that there are options, that there's going to be some flexibility for those that may not feel as comfortable. And what does that look like? So I think it's very important to make sure that employers are very flexible and allow their employees to know about the different options that are there for those of us that are coming back into the office. You guys probably saw my kids popped in twice so far. So being able to manage childcare, being able to manage if you have dependents that rely on you, older family members, younger family members that may depend on you. So being able to have that flexibility to be able to maybe work in a hybrid type environment, maybe not all back in person, maybe not all virtual or remote, but what's the support system there for employees coming back to work?
Okay. Another topic that we will touch into more detail. Thank you, Joe.
Thank you, Director Howie. And I just want to I want to first of all second all the comments that have been made thus far. I won't repeat them except to say that communication is absolutely key. And if I had to communicate one thing right now in terms of our shared community of workforce, from a worker perspective or a management perspective, from a community perspective, is communicating on the facts and not the myths, and communicating on vaccine hesitancy, meeting people where they are on vaccine hesitancy, hearing first, listening, not trying to tell folks that they're wrong for their perspectives, and remembering all the things that we all remember about hesitancy, and then making it a conversation about hesitancy and not hesitancy and but. So and saying that the number one thing people can do when a vaccine is available is to take it. I will say, following up on the chief administrator's comment, are that I think Baltimore County, honestly, has done amongst the best job regionally, if not just in Maryland, on vaccine distribution, just straight up. Just an outstanding job on that. We're still facing a shortage of the number of vaccines, but when people have an opportunity to take the vaccine, they should take them. Now, getting directly, Director Howie, to your question, one last point from a workplace employer standpoint, and that is this, that even in parts of the country where you see that basic infectious protocols are still in place, but for instance, mask wearing is no longer ordered, as an example. Even in those parts of the country where mask ordering has been lifted for the general public, employers and employees are continuing to wear masks and doing well. And so I think doing everything you can to keep a safe workplace in terms of infectious disease protocols, communicating that, going above and beyond the call, and communicating about the vaccine.
Okay, thank you. Carla.
Hi, how are you?
Fine, how are you doing?
Good.
Good.
Just joining. Thank you for letting me come in late.
Oh, okay.
Literally just got back into the office, so.
Okay, well, I guess I need to give you the question then, huh?
Yes, please.
Okay, the question is, let me get to my list here. As each day goes by, we get closer to fully reopening the Maryland economy, but just because reopening is on the horizon, we know that many challenges will remain. What are the most important actions that an employer can take to make employees or even customers feel safe from a health perspective in the workplace? You can address this question from the perspective of management as well as from the perspective of an employee.
Well, as a business owner, I'll give my disclaimer. I don't have employees, but I have plenty of clients. And so for me, when I'm talking to my clients, customers, potential, it's always to assure them that I am taking the necessary precautions, whether I'm working with them in person or remotely, just to let them know what I'm doing. I literally just got back from a client, that's why I'm late. But it's important to always be masked up, and I'm a hand sanitizer person anyway, so kind of anal in that regard. But just letting people know that you, even if there are people that have issues with the mask or the vaccine, I'm letting people know that it's important for me to be masked up, even though no, I don't like it, but I'm going to do it because it's the right thing to do, and it's important for me to take the vaccine because it's crucial to the work that I do, and I just want to say. The other thing that's important is I tell my story. My husband works in an environment where he has to get the vaccine. I have my neighbors, they work in an environment where they have to get the vaccine. I don't. I work from home. So technically I don't have to get it, but I hate feeling left out. And so if I want to be included and if I want to be around my friends who are vaxxed, I want to be vaccinated. So it's about I don't want to be left out. And I just believe that if you look at where business is going and society in general, we're moving towards that area. There's going to be vaccine passports. You're going to have to show it when you're going to various environments, whether it's social or business or otherwise. And just get on board. Don't think about it. Just to kind of be your own ambassador. And when you're an ambassador about why you're doing it, I think it helps to help others to understand the importance of it and to dispel some of the myths, because there are a lot of myths out there, a lot of conspiracy theories and just superstition. So in order for us to get back to normal, I'm a hugger. So in order for me to be able to hug my friends and family and my colleagues, let's do this. I literally put it on, I think it was on LinkedIn yesterday, and they were talking about airports. I work in airports, and I'm like, come on, folks, I want to travel again. Let's get vaccinated so we can get back in the business of traveling, doing what we used to do, and loving life the way we used to. So I'm just my own ambassador to my customers and my clients, and that's how I do it.
Okay, thank you. Anna Maria.
Good afternoon, everyone. I'm Anna Maria Palmer, and I'm the Vice President and Chief HR Officer for GBMC Healthcare System. I also have the pleasure of working with Leonard on our Baltimore County Workforce Development Board. So obviously, I echo the thoughtful sentiments that have been shared, and think of some other ways that we can help people get back to work. So certainly making sure, as we alluded to, that they have all of the safety tools that they need, particularly the PPE, the masks, the hand sanitizer, and showing that our workplaces are clean and safe. Obviously, that's very important to us in a hospital and a hospice and healthcare system. But the other thing that we've encountered is that many of our employees need help. They need assistance. While we've been able to maintain employment at GBMC, many of our employees' spouses or family members have encountered workplace difficulty with their jobs. And so we've started a workforce hardship fund where we're helping employees who've had unexpected bills because of their spouses or family members losing their job or being underemployed. And we're also constantly searching for resources for our employees, because if we can help remove some of the distractions from them and their families, they're more apt to come to work. So most recently, FEMA posted on its website, for those of you who aren't aware, that there is a FEMA program now to help pay for funeral costs for COVID-19 related deaths. And so we have been helping our employees navigate that website and those resources so they can apply for these reimbursement grants for those that have been affected. So what we're finding is now more than ever, employees need help with their overall situation, not just their work situation. And so we've been trying to take that tack. And so whatever that, obviously we can do from the county perspective to help with that will really, expedite the return of the workforce.
Okay, thank you. Allie.
Hi, everyone. Allie Von Paris. I'm the owner and founder of Route One Apparel, which is a Maryland-themed clothing company, and we also sell licensed product like Old Bay and Natty Bow. We have a fulfillment center here in Towson. So during the pandemic, the products can't pack themselves. Unfortunately, we haven't figured that one out yet. So we've been here working and growing, thankfully. But we've experienced those challenges, like Leonard brought up, of making sure there's a consistent message with CDC protocols and countywide specifics. I remember back in March, we were listening to the governor's press conferences daily and using those as a guide on how to extend those protocols to our business. So I mirror everyone else's thoughts about communication is key. I also know with the many states opening up, I'm seeing those inconsistencies because A, things aren't being reminded and communicated, and B, people are finally starting to do some things they haven't done in a while, and they're really just kind of unsure of what to do and what to follow. When I'm at a restaurant and I see someone getting up and not putting their mask on, you immediately see some people coming over saying, put your mask on. But in other places, they're a little more lax. So I do believe that the county executive and, people up at the top should just kind of remind people about what the protocols are for us in our business, because we've been navigating this pandemic with a team here. We have made sure that we followed like CDC protocols. Everyone wears masks when they're walking around or in a tight space. And thankfully we're very OCD over here anyway, so we're just over cleaning everything. But I do see with my employees, with some getting vaccines already and traveling, there's a little bit of judgment sometimes when you're like, oh, you're getting on a plane, so I think with leadership, just taking a stance on sharing what's a consistent message might bring some more ease to various businesses, and they'd also finally be able to kind of just say, well, this is what is being told of us, rather than having it come from maybe a boss or CEO just with their own opinion. So that's just my 2 cents on everything.
Okay, thank you. Jasmine, do we have John yet?
I do not see him.
Okay. Okay, thank you very much for that first round. Okay, we'll go on to the second round, which is very closely related. Many of you, all of you talked about the need for communication to be consistent, leadership to be flexible, operations to be flexible, and that essentially meets the employees where they are, and trying to get them back comfortably, safely, and willingly into the workspace. The second question is, with that as one of the major items that you identified, what is it that we as county government can do to best support the workforce within your industry as we prepare for the next phases of the post-pandemic economic recovery? Question is a little broad, but you can make it as narrow, your response as narrow as you want. So what can a county government do? So this is really the wish list of activities that we can do to best support the workforce within your industry. We'll start in reverse order. So Allie, you get to go again.
Yay, I love going first. Okay. So actually, I'm part of the Baltimore County Economic Development Committee, and we had these challenges that we were discussing very recently. And something that I'm very excited about that we talked about, because I'm all about branding, is a campaign called BC We're Local. BC standing for Baltimore County, obviously, but also because. And I think that right now, what I'm seeing and what has resonated with me over this past year is just the support of the community, the local community supporting each other. And that can also come from a county standpoint, the government standpoint, is just the government prioritizing local businesses that they're supporting. And so this BC We're Local hub that we're thinking about putting together, let me read some details about it. So we thought it would be a branding engine for policies that small businesses can utilize, and it could be pushed out by the CE. So it could be essentially a hub where there's policies and perks for local businesses that they can apply and use. If there's a tax credit that either is applied to a business or for recruiting talent, that could be showcased on there. It could be a place for others outside of the county to see how strong and connected the community in Baltimore County is. And there's a couple other instances that we provided as examples that I've just seen recent. Maryland Marketing Partnership is one that's a statewide initiative where a lot of businesses join and showcase their identity, and it is pushed out through like statewide PR. is another something that we can all be that we're all probably familiar with is American Express's small business campaign. Obviously, that's a day, but we think that BC We're Local could be something that's pushed out year round. So I think that just embracing the fact that we're only as strong as the community that we come from. That's a message that was very clear and obvious during the pandemic when there were a lot of businesses that struggled and others rose above and helped them out. And I think that from a county standpoint, if they take that messaging and make it very clear that that's something that they want to focus on, I think it could really resonate well with everyone.
Okay, good. Thank you. Anna Maria.
Great. So from my narrow perspective, obviously we're in healthcare, and the one thing that the county can continue to assist with, because you've been a great partner, is around training and retraining, particularly in some of the allied health occupations. COVID, has shown us that there's been obviously now even increased demand in the healthcare field, and it's been a challenge in this greater Baltimore market. We are healthcare rich, but we have a finite pool of talent for nurses, for CNAs, for nurse support techs, and even for some of the allied roles around transport and dietary. So continuing the partnership with businesses around training and retraining, and maybe doubling down our efforts in the coming months will be a help, certainly to the healthcare industry. And it's not just for GBMC, but my colleagues in healthcare. We're all struggling with the same limited talent pool.
I may be going out on a limb here, but I think in your role as chair of the Workforce Development Board, you may have something to do with that as we move forward.
There you go.
Okay, great.
Okay, great.
All right, Carla.
Okay, I was trying to unmute. Hi. Ali and I work on the Economic Development Board, and we're both a part of the Small Business Committee. So one of the things she talked about is our branding. And another recommendation that there's two that I'll just say quickly. We are hoping that we can get some of the large corporations that are located in Baltimore County to consider procuring some of their goods and services from the small business community that are located in the county, because it'll do a couple of things. It helps to regenerate the dollar in our own county, and it keeps us employed. It keeps all of us employed, and we would support one another. And it also provides opportunity for small local businesses that they would not otherwise have, because while we understand certain things need to be purchased in bulk, there are some procurements that can be purchased in a smaller quantity using a local customer. And we just think that that's just a good thing to do, just to help our regenerate and revive our own local economy. Something else we talked about is, I noticed that the county is doing I'm pointing at my screen because of the job fair that's happening in manufacturing, and manufacturing is getting a lot of play right now, and I'm happy about that. But there are many small businesses in the service industry that could use some help too. So one of the pieces that I brought up is, can we have something where we provide a launch pad or an onboarding for solopreneurs, small businesses that are looking to hire their first or second, third employee, but the benefit is they're hiring someone off of the unemployment rolls. So you have a Baltimore County small business that's going to hire someone that's in Baltimore County, get them off the unemployment roll, but that new business needs some guidance and help on how do you to deal with your local taxes and payroll tax and all of that, because it's new for that solopreneur. But we should consider doing a job fair for the service industry. And that can be broad because restaurants fall in service. And believe me, if I've been a waitress before, if you can handle people in a restaurant environment and with a smile and deal with it, you can handle any kind of customer service type of environment. And they are great people to hire in your company if you're doing some other type of service. If you have a service type business, whether your customers are the public or B2B. So those skills can be transferable. So I would really think about having a job fair for people that are on the service side. And then those smallpreneurs, myself, that would like to hire, have some resources there. And the resources the county already has. We just need to be more congruent and make it happen, so that that's where the tide lifts all boats, but everybody has an oar in the water to help row so we can all get, back to shore. So.
Okay, great.
But that's in our recommendations from our
Right.
Our economic development. So you're going to get them at some point, but it would be nice to think about that as we're coming up with the next fiscal year, which will be here in a blink of an eye. So.
Okay. All right. Thank you. Joe.
Great question. I guess a couple things come to mind. As Anna Marie said, in healthcare, workforce was a challenge prior to the pandemic. It's going to be even a bigger challenge and opportunity as we navigate this part of the pandemic and forward. So workforce recruitment and retention in healthcare. And what that means is there's going to be tremendous opportunities on entry careers, mid-level careers, and really high wage earning careers. It means backstopping and getting folks in those careers. But it also means that we need to lift up the nurses' aides that want to become LPNs, and the LPNs who want to become nurses, or like the people like my mom, who are the cleaning people who clean the toilets, who say, look, I want to be more, maybe I can go back to school and become a clerk or an accountant in the office. We have tremendous employment opportunities in recruitment and retention in healthcare. Now, more generally speaking, coming out of the pandemic, 3 buckets come to mind. One is helping people in terms of resiliency and turning a corner. I think we're going to have a huge public health, mental health need in the community that the county is going to have to take a leadership role on. 2, we're all concerned about our kids. We're all concerned about our kids, and did they lose a step, and how much of a step, and how much can we uplift them? And then finally, these workforce issues. I love Allie's BC local. It's also BC we care, BC we're family, with regard to the workforce issues, the family issues.
All right, great. Thank you. Deidre.
Thank you. Yeah, I loved Allie's comment around the BC. I thought that was a really cool play on words, but then also just showed the commitment to the county. So I think there is so much information out there, so many different resources. I think people get a bit overwhelmed. I know when I work with business owners, just in how to find the resources, it could just be a struggle. So whether it's with the site that Allie and the team, Carla and team are kind of working on or proposing, I think that is where we could put some really good, succinct information for folks on the resources, as Anna Maria and Joe were mentioning about just healthcare and the need for workforce development and finding strong talent. Maybe even having a direct, if businesses in the community, in the Baltimore community, are looking for new hires, could there be a way that, there could be a directory of businesses showing the opportunities that are available, so then you connect the people that are looking for jobs with those that are looking to hire people. I think that would be extremely helpful. And then I know, Anna Maria also mentioned the first question, or her response to the first question, which is around FEMA and, being able to provide, funeral costs. I think, also putting information like that on some type of site to help people understand what resources are available, not only nationally, but what resources does the county have? Like the hardship fund that I forgot who had mentioned that earlier. But just being able to provide just a really nice, tight, succinct place where employers, employees, just community members can come and get information on resources that are available for the county to both support small business owners as well as to support the constituents that live in the county. I think will be extremely helpful as we're all struggling just to try to figure out what our normal is going to be. Many of us are dealing with mental and emotional health issues. Our children, like Joe mentioned, we don't know how far behind they may be. They're also having emotional issues as well, just not being able to engage with their little friends and their small community of teachers and support system. So I think those are just the ways that we can focus on the health of the county, is by really helping to our constituents and our employers just really figure out what's available out there for everyone to take advantage of.
Okay, thank you.
You're welcome.
And Marcus.
Yes, and I love the BC We're Local. It's very, very hip and very young, which is a great thing to connect with folks. Well, Leonard, I think one of the most important things we can do is to continue developing and promoting resources for helping the out of work, and especially those in services, to find new positions. During the pandemic, we've seen so many businesses being forced to shut down. I know in Timonium alone, we've had the closures of Jason's Deli and Zoe's Kitchen and the legendary Szechuan House. And they've all been forced to close because of COVID. And a lot of people, they've lost their livelihoods, and more so, they've lost their identities. And so they need new work, not just to support their families, but to reclaim their personal dignity. And no matter what kind of unemployment assurance or assistance the county and the state and the country have been able to provide, it's never going to be a substitute for honest work. And these folks, they have lives and families, and they don't always have the time to retrain or reposition. And so we need to focus on their immediate needs and doing everything we can to reach them, to find them, to help them get back on the ladder and get back into the workforce.
Okay, thank you. Powerful stuff on the second question. A follow-up for everyone. Please chime in with response if you have one. With communication being raised as such a serious issue, and the need to ensure that our population gets the information that's out there, I'm positive that members on this call from our communication shop are probably scratching their heads to some degree saying, has anybody looked at the website? I mean, and not just ours, but others, that there's so much information out there already. But what you're raising is a real issue. Not everybody goes to their computer, logs on, and search websites to find out information. They don't do it on their phone sometimes. Sometimes they do. Sometimes, I think, as you mentioned at the outset, they get their information from alternative sources that may or may not be accurate. What are your thoughts on the most effective ways to actually get the messages out to the people who need them? If we know we're not going to get them directly through our normal forms of communication, what other ideas are out there or things that the county needs to do to get the word out?
May I?
Yes.
Hi. This actually came up in our subgroup. You're right. There is a lot of information out on the county, but it's disjointed. And we as business owners, when we're looking for something, and this is the mindset, I think information on websites are placed depending on who's putting it out there, as opposed to who your customer and who's going to need that information. So while the agencies are thinking about it from their perspective, from the user standpoint or business standpoint, we're not trying to go from one agency to the other. We just need it, bam, all in one location. And so we've actually talked about how we can gather, if nothing else, a landing page on the county's website that at least gives you the information and the link, so then you can go someplace else. But to try to hunt and peck and search after a long day you've been working is a bit much. Then you do couple that with PSA announcements, not just so much like we're talking about the BC local, but there's some, the county can do their PSA announcements in different forms. However, we're communicating information, like I get the press releases from the county once a week or twice a week, getting it out that way, because the nonprofit organizations and community organizations are then they're also sending it out to their community. So however you're sending out your regular county messages, do the same when it comes to this work as well. And just, even if it's people like taglines and catchy phrases and, everything. And we can do the same thing when it comes to even saying, go to our website. No, I don't know if the county says, go to our website, find more information, 1, 2, 3. So yeah.
Okay.
Just repeat it. Marketing is constantly repeating.
Right. Good.
So
That was
I was going to chime in because I need to go for a 1 o'clock meeting. But
Okay.
the one thing, and I echo what Carla said, it's hard for people to have to go one more place after, a long day. But, we have so much opportunity in the county with the one-on-one touch points that we have through our one-stop job centers, through our other various agencies, Department of Aging, et cetera. And so maybe there's an opportunity to do communication in the moment at the time of touch point, whether it's, in the form of a paper or distribution or in the form of collecting, cell phone numbers so we can push out communication about various resources. I mean, heck, you can't buy pet food without their wanting your cell phone number so they can tell you more about the pet food next week. So maybe there's an opportunity for us to take the communication to the community rather than asking the community to come seek it out from our resources. So just a thought.
Yeah, I completely agree, Anna Maria. I was actually laughing because I always get these pesky messages and I cannot for the life of me figure out where they're coming from. It's like text messages all the time that get sent to my phone about something. I'm like, how did I sign up for that?
Right.
But I think, most people are, attached with their phones. So if there was and I think people would pay attention if it was something that was COVID related and something that came from the county that said like, hey, resources available, please check out our website, just clicking the link. I don't know if, when people are registering their businesses, if that could be something that, since we have phone numbers, that's automatically captured. Now, I know there's also, there's laws against, outreach to people if there's like a do not call list, but I think that could possibly be one of the easier ways to connect with people is through text messaging, auto text messaging. And then I know not everyone uses social media, but Instagram seems to be a really big deal. And I'm constantly seeing those new ads that, pop up. Depending on a certain zip code, if you live in a certain zip code, you may get an ad for a business, depending on how close they are to your where you're located. So that might be helpful as people are logging on to their Instagram for the day, I guess, to check what's going on Instagram or Facebook, just to kind of like something pops up to say, COVID information from Baltimore County. Now, again, I don't know if that's possible, but just an idea that I was thinking could possibly work for the county.
Okay.
Hey, Leonard, Joe D'Amatos, one
Yes.
last point, at least from my perspective, not from, other people got stuff to offer. Look, the county's doing a great job on the information being out there and the website being out there. It's great, truly. But there's a couple of things to the earlier comments. We're all tired. We're all overwhelmed. There's only so much time in the day. And even a non-pandemic environment, the most effective communications is push and pull, right? It's pushing out information through a website, through a press release, through an ad, and it's pulling information back that's initiated from the consumer, whether it's the constituent, the viewer, or the buyer. So I second everything that's been said here, but maybe also if you're pushing out information via text or pushing out information via whatever method, include a survey component, include a question that draw people in and their engagement and pull them in to it so that we did have a more of a push and pull dynamic to it. It's time consuming, but it will raise the level of engagement.
Okay. Good. Thank you. Good ideas.
I just put it in the chat, but Leonard, just in case you don't get a chance to see the chat, what Deidre was saying, Baltimore, Prince George's County does that. My personal cell is through Prince George's County. So I don't know how they're able to get it, but the county has all of the cell numbers and they're constantly pushing out information about COVID, what stage they're in, different, what to do about masks. So it is possible. And I'm sure as a government agency, you all can figure that out, but they have our numbers. And I even got one from a state delegate that was located in Prince George's, but I'm always getting information from county executive Angela also Brooks. And because it comes just like that, you read it because it's from your leader. So you want to read it. And then I said, oh, okay, I know what this is. But yes, it can happen. Yes.
Okay, thank you. Thank you. Okay, final question. We know that this pandemic has not impacted all employers equally. While many have closed or significantly downsized, others have experienced steady or even record growth. When you think of your business or industry, are there any strategies or changes in operational procedures that have helped your organization remain operational or even grow? And this question is designed to really tap into some of the creative strategies you had to employ to stay vibrant, to stay alive out there, while still adhering to all of the safety protocols and concerns that your employees might have. So this time we're going to, Anna Maria, did you have to go? Are you still around, or did she have to go? She's gone. Okay. Let's start with Carla.
I can't really add to that. I was thinking about Allie. You might want to ask Allie because it worked for her. For me, I was hanging on by my fingernails this last year. Vaccine is helping my company to reopen, but I just shut down and stayed in place last year. So
Okay.
I'm not the best person. Thanks.
I'm happy to
Okay.
jump in.
Okay, Allie, go ahead.
Okay, yeah. So, just some perspective on my business. We're a business that our main target audience is the local community. We sell Maryland themed clothing and accessories, but I also realized that despite the fact that we're a fulfillment center, I don't really necessarily see selling Maryland themed clothing and accessories as essential. And I see it more as like a want versus a need. So I was very worried about the direction of my business, especially like in March and April of 2020, when I just saw doom and gloom, and I was seeing doom and gloom with a lot of industries. But something that really, really worked for us is the fact that we are working with a lot of local vendors, and a lot of our supply chain is local here in the community. I immediately reached out to all levels of our supply chain, our retailers, our manufacturers, and I said, what's going on with you guys? What's happening? What are the changes with your business? And like you said, I had to turn on my creative side of the brain, and I had to really change, but I also listened to like what everyone was saying were their struggles and what was happening in their industry. And I immediately tried to focus on finding solutions for them. Because I had to think outside of my own business's bubble. And so with my retailers, I realized they're brick and mortar. So I started hosting their products on our e-commerce website. For our manufacturers, they told me that most of their business, they do a lot of stuff with event themed stuff. And obviously events were all canceled. So we immediately tried to figure out ways to utilize their manufacturing on new product launches. So when I expanded my network to other businesses in the community and figured out how I could kind of help them out, it in turn like helped with getting our name still out there in the press. We were launching new products and sharing all of that. So that's what I started noticing was the real pivot for us, was just kind of spreading our wings and working with industries that I would otherwise not work with. So that was really what helped us stay viable in the beginning. And then, so then we just started kind of making, the face masks and other things like that, which obviously helped. But even if you eliminate the face mask sales that we did, what really, really helped, which is why I'm really advocating for this BC We're Local thing, is that, McCormick, one of our licensees, came and started utilizing our website to sell their hot sauce. And, it was a lot of changes in, the way that our business operated. But when I summarize it all, basically, what's changed so much for us is that we're working with all these different new partners that we've never otherwise worked with. And we're only as strong as the community that we're supporting. And, you know, what we made sure we did, because we've had a very successful year, is we just gave back to others. And we've made sure we prioritized industries that we wouldn't necessarily touch as well. And I think that's something that we should encourage as well, is there's businesses out there that are doing really well right now, and they shouldn't just be celebrating and keeping it to themselves, because we're doing things that are the pandemic is a challenge that's out of our control. And so, yeah, those are just some of the things I wanted to share.
Okay, thank you. Joe.
Well, I just want to thank Allie for what she just shared. You know, I'm going to have two takeaways from what she just shared. Leaders pause and they find out how they can figure a path forward and how they can be of service. And, you know, she paused, she called her vendors, she asked them what she could do for them, and together they found a new way forward. And I think that was incredibly powerful. You know, it was similar in healthcare, except with one huge exception. We have the opportunity to close, right? Whether we were a hospital, a hospice provider, nursing home, assisted living, you know, closing wasn't like an option. And like Allie said, the boxes don't pack themselves. People don't, you know, we need professionals to take care of them. And so I would say that the biggest pivot, the biggest positive pivot came from state and local governments allowing us to bring in licensed professionals from other states or surrounding counties and to use volunteers. Because believe it or not, we had a fair number of volunteers show up in healthcare and do the stuff that they were allowed to do legally, and then freeing up other sets of hands, you know, for the work that needed to be done. So I think, you know, looking to model that behavior in environments where we have more control going forward, you know, unlike a pandemic, will be very important.
You know, Joe, I think that goes to your earlier point, as well as Anna Maria's, I believe, that there were significant opportunities, employment opportunities in the healthcare sector. And we need to do our best to recognize that, identify them, and get people trained accordingly for various progressions up and down that ladder.
Right, bottom, middle, top. Tremendous time of opportunities going forward.
Okay, thank you. Deidre.
Sorry, my mute wanted to play games with me, so I apologize for that. But yeah, we had to make some hard pivots. Of course, you know, we're in an industry that we rely on small businesses for our business. So with the pandemic and you know, this is, like you said, it was the first time any of us had really experienced something like this. And we had to pivot in our technology. So, you know, when the pandemic first hit and the PPP funding was made available, you know, M&T, we were not necessarily known as the big fancy technology company, right? We were a little bit more conservative and being, you know, first to market with technology. But we set up a portal to be able to process the PPP loans pretty quickly. We, you know, got a large influx of applications. So that taught us right there the need for being a little bit quicker to market with technology. Thoughts and ideas and needs, which also allowed us to think differently of how we engage with clients. So because we couldn't really meet with people in person, you know, had to limit the amount of people that came into our branches, but then also from those that are on roles like myself, where we meet with business clients or, you know, mortgage loan officers, you know, having to, you know, pivot and meet people virtually like this. And we're so accustomed, I'm a hugger too, Carla. We're so accustomed to being in front of people and working with people day to day that we had to figure out other ways to meet people where they are. I think Joe made that comment, or one of the others made that comment about meeting. Marcus may have made the comment, meeting people where they are, right? So we had to find different ways to engage, which also allowed us to identify opportunities to not necessarily have to have employees work in market for certain roles even. So being able to hire people, you know, for roles that were out of Buffalo, where we're headquartered, being able to hire people in the Baltimore market to take over some of those roles. So just being really flexible with our technology efforts, finding opportunities to meet people where they are in terms of how do we engage, and really better understanding what the needs are from the community is really what has helped us. So the more you can take advantage of technology, in whatever ways that is applicable to the county, I think that would be a really important thing to focus on, as well as just always just trying to find a way to meet your customers, which this is the citizens, the business owners of the county, where they are and what their needs may be.
All right, thank you. Thank you for that. And Marcus.
Saving the best for last as always, right?
Absolutely.
Well, then there must be someone else after me. Well, from a personal perspective, I will say we were frankly very blessed and we're very fortunate, and for those who don't know, Zytogen is a genetics testing laboratory. We sequence a genome of embryos for prospective parents who are undergoing IVF, so they can select the healthiest and most viable embryo for transfer for successful pregnancy. Well, this means, among other things, that we were already equipped with filtration, with clean labs, with personal protective equipment, and I think most importantly, the scientific understanding and the personal discipline to navigate this crisis. And we didn't miss a beat, and we've maintained clear and constant communication among our team, who are really fantastic folks, all much more credentialed and a lot smarter than me, to be fair. And we've maximized personal safety by coordinating new protocols to sort of continue our work while limiting unneeded in-person interaction. And so it's been very successful, and we're so very appreciative of everything we have. And I think whatever lessons might be applicable from that, I think really the larger lesson is chance favors a prepared mind. We were fortunate to be prepared, but more importantly, I think there was a lot of great communication among all of us about everyone's concerns. Some folks were asking questions about the variants and the vaccines, and we're able to draw upon a collective knowledge to help each other and guide each other through this crisis, and that's been very important.
All right, thank you. Now, the last task for today is I'm just going to go down the list one more time, and if you could just give me one word, one or two words that describes the most fundamental skill set or characteristic that an employee needs to have in your environment during this time. So what's the most important skill set and or characteristic that they have to possess to be successful in your industry during this time? So let's start with Ali.
Oh, this is hard. I would say patience, because it's been a struggle, all the accommodations that we've had here, and also customer service has been interesting during a pandemic with shipping delays and stuff like that. So I would say patience.
Okay. Carla?
I would say grace. We have to give everybody a measure of grace. When I don't hear back from people, and for whatever reason, I'm like, it must be Corona related. And sure enough, it is. And I thought maybe I wouldn't have to use that Corona related this year, and I still have to, because they're either affected directly or indirectly. And I like what I think it was Anna Marie said about concern about the employees and the patients that they serve. We just don't know how this is hitting everyone. It hits me in ways that I won't talk about right now. And it's difficult. So we have to give everybody a measure of grace. So, yeah.
All right, thank you. Deidre?
I would say being an agent for change. So, just being someone that we're in a changing environment. I feel like every time you turn around, something is different. So being able to accept the fact that things are changing, and we're not going to get it perfect. No one has the handbook for what this looks like. So just being someone that is open to change, and really willing to be flexible during this time. I think those are going to be the ones that remain resilient during this time.
Okay, thank you. Marcus?
For us, the one word is discipline. In our line of work, we have to be perfect and get it right every single time. We can't make a mistake, can't afford to. So we have to have discipline. And in the time of COVID, we have to be disciplined in washing our hands, in socially distancing and wearing our masks, in following the changing protocols that are meant to keep everybody safe.
All right, thank you. Thank you. And Joe.
Let me just say that I'm gonna add on to grace and agent of change, and then my word, comma, is determined. Determined.
Okay. Well, thank you all so much. Outstanding discussion, outstanding comments, recommendations that you all had. The input will be added to what we were able to glean from our other two roundtables. And in fact, I'll just share this quickly. Yesterday's families and individual session, the same concept of kind of one-stop shopping for information came up. So since we heard that from two separate groups who, let's face it, aren't always on the same side of issues, I think that's powerful. That we should really take a hard look at making sure that we are communicating as effectively as we possibly can, and even if it's a website thing, what's that old rule we always had to do in development? Follow the 3-click rule. You should never have to click more than 3 times to get to where you want to go, and if you do, you don't have a successful site. But we also know that it's about more than a website. It's getting them where they are, and they have that little device in their hands all the time. So we have to figure that one out. But thank you so much for your participation today. This does conclude our initial 3 roundtable discussions that the subcabinet will take into consideration, and we look forward to getting back with each of you in different forms, perhaps, and just sharing what we've learned. So thank you all for participating, and see you out there.
Director Howie,
Yes.
before we say
Sure.
we sign off, I just wanted also on behalf of the CE and on my behalf, we really appreciate the thoughtful feedback. There are a lot of pieces and wonderful ideas that have come out of all 3. And I would say if there's something that we, the county, can do to work closer with your respective industries, we definitely want to do that. This is definitely about collaboration. We're all in uncharted water and have had to do things from blank sheets of paper, but we will definitely have a good case study at the end of all of it, how we in Baltimore County work together collaboratively to do many, many things that we didn't have any game plan up front, but we certainly pulled things together to support the community. But that wouldn't have happened without the support from colleagues and the spirit of can do here in Baltimore County, which to me is just wonderful. So look forward to working with you further. And Director Howie, again, wonderful job, excellent 3rd session, lots of action-packed pieces that we can go back and look at.
All right. Thank you, Madam CEO, and thank you for those closing comments. Everybody, have a good one. Thank you.
Take care.
Leonard.